So hello friends. So you must be busy up in studying up for your exams. So we'll discuss up some miscellaneous topics which like in the college also very less everybody discuss up and they tend to come in the exam, so that you should know. So we'll give you an overview of all those, that at least something कुछ तो लिख दो exam में. So that type of a session this particular one will be. I will tell you like what to focus upon in these particular topics if these questions they come in your exam. Okay. So one of the questions definitely which can come in your exam is regarding the zoonotic infections. Okay. Regarding the zoonotic infections. And in the zoonotic infections, we have these particular names like the disease name, obviously, the plague, the brucellosis, tularemia, the rat bite fever, cat and dog bite infections, and even like obviously the human infections are different one, but they just like tell up. So zoonotic infections, as the name suggests, which are there because of the contact with the animals, and the infection is there from the animals by any of the routes by eating up contaminated meat and milk with the organism or through the aerosol route and all. So those particular things they are termed as what? These particular zoonotic infections. Is it fine? Now, first of all, we'll talk about the two important zoonotic infections. One is plague and one is brucellosis. Okay, one is plague and one is brucellosis. So first of all, if we talk about the plague, okay, as you can see up, what in the short you can write regarding that, that is there in this particular topic. The Yersinia pestis is the organism which does this particular disease, plague. Okay. How many types of plague is there? The plague is of three types. One is bubonic, one is septicemic, and one is pneumonic. Okay. So you can write a BSP. Bubonic, septicemic, pneumonic. So definitely you can find up in your exam some like short note on this or a long question on the zoonotic infections in which you have to write up these particular important things. Like BSP. What are the BSP one? Bubonic, septicemic, pneumonic. Okay. As the name suggests, bubonic means there's a formation of buboes, that is the lymph nodes. Septicemia happens, that is septicemic. And the pneumonic plague is also there in which the lungs are involved. So that is termed as pneumonic plague. Now, the question comes कि कौन सा सबसे ज्यादा dangerous है? Which one is the most dangerous? Bubonic, septicemic or pneumonic? So answer to that question lies in the incubation period and severity. So incubation period is 1 to 3 days of pneumonic plague, and this is what is termed as the most severe. This is what is termed as the most severe. Then comes the septicemic, and the normal one is bubonic plague. And as you know, that plague is one of the disease which have killed over the world a lot of fellows before. Millions of deaths happened by this particular plague. Now it has lost its virulence. Very few cases they are being reported nowadays of this particular one, but still it is there. But it has lost its sting for sure. Okay, guys. So you should know about plague for sure. Three types: bubonic, septicemic, pneumonic. Pneumonic is having the lowest or shortest incubation period, that is the 1 to 3 days. So very easy to transmit, and having a very short incubation period makes it very dangerous. Okay. Then comes the septicemic and then comes the bubonic plague. As far as the culture media is concerned, the culture media, if somebody asks you directly here, the culture media obviously comes in the lab diagnosis, but why I'm telling it? Because this is one of the things to be highlighted in the exam. So remember the culture media for the Yersinia pestis is what? Ghee. Okay. Nahi. Ghee broth is the culture media. And this particular ghee broth is used to culture up the Yersinia pestis. And which type of a growth happens to be there in this? So guys, stalactite type of a growth. You should able to write up in the exam stalactite type of a growth. And what is stalactite type of a growth? The stalactite type of a growth is like suppose you are seeing up now in this. Suppose a test tube is there, in that ghee is there, and you put up this Yersinia pestis it grows like this with the conical projections, this particular one. This is termed as stalactite type of a growth. And this happens to be in which particular culture media? This happens to be in the ghee broth. This happens to be in what? This happens to be in the ghee broth. Okay. You must have seen those projections in the ice glaciers like Amarnath and all, those who come like this. This is what is termed as stalactite type of a growth. And it happens in whom? It happens in Yersinia pestis, which does which particular disease? A zoonotic disease, plague. Okay. So nowadays, the question in your exam also can come in this particular way that some food inspector have gone to the godown. Okay. A particular godown is there for the inspection, that fellow have gone. In that food godown, there is no light or there is darkness. In that darkness, something have bitten that particular individual. Okay. What is that something? So that particular something is obviously either the rat flea or either the rat. Okay. So that particular thing have bitten up, and after that, obviously the incubation period is 2 to 7 days. After 3 to 4 days or after 2 days, they can say in the exam, that particular individual develops what? That particular individual develops fever. Fever with what? Fever with lymphadenopathy. Fever, and along with that, what else will be there? Lymphadenopathy. And this particular lymphadenopathy manifests as what? Inguinal buboes. Hi, Tinu. So this particular one is termed as what? Lymphadenopathy. In the inguinal region, it ought to happen, and that is what is termed as inguinal buboes. And because of this swelling only, what we call this thing as bubonic plague, because this is what is remaining nowadays. Otherwise, all others are not there now. Okay, or very few reported. The only reported ones is what? Bubonic plague. आजकल जो आ रहा है ना, वो just bubonic plague ही है. And what is this bubonic? Buboes, lymph nodes. That is the lymph node swellings, termed as in the inguinal region, inguinal buboes. So that particular individual, or they will give a case scenario that this particular one is having fever along with inguinal swellings. Basically, the lymphadenopathy, that is the inguinal buboes, they are there in that. Okay, so this is a characteristic feature of what? Bubonic plague. Now, another thing which you should have in your mind is that which particular index we need to see up in this. Okay, so important is rat flea index, and it is also termed as Chiopis index. This particular thing is also termed as what, guys? Chiopis index. So this Chiopis index needs to be there. And what is this? Whenever a epidemic before used to come down, so this particular index used to increase, Chiopis index. And that gives us a, what do you say? That gives a hint that in this particular area might be the epidemic of plague coming. So this is an important indicator. Used to be before, but now it is not so. Nowadays, what is being reported? Inguinal buboes, that is in the bubonic plague along with the fever. And as the bubonic plague is one of the common entities reported nowadays, so obviously the lab diagnosis also revolves around the same. Okay. And in the lab diagnosis, what we have, obviously from those particular inguinal buboes, you will take the smear, you will take the biopsy of that, tissue biopsy, and you will prepare what? You will prepare the bubo smear. And then you will take the patient blood, and from that also you will prepare what? Blood smear. So blood smear and bubo smear, these two are there, and you put up them with a particular stain, and the name of the stain is what? Wason stain. Okay guys, so अगर एग्जाम में वेसन स्टेन का नाम आए तो इनडायरेक्टली भी अगर ये क्वेश्चन आता है ना, मतलब ये एमसीक्यू फॉर्म में भी आ सकता है. दिस क्वेश्चन कैन कम इन द फॉर्म ऑफ एमसीक्यू आल्सो. So these bubo smears, blood smear, when you put up in the Wason stain, what you observe, guys, you must be knowing the Yersinia pestis is what? The Yersinia pestis is a bipolar safety pin appearance. Okay, bipolar safety pin appearance. Okay, it is having this type of appearance, and it will be looked under the obviously a microscope. So important stain name also you should know, Wason stain. And if this is not given up, Jimsa stain. Vasen stain, Giemsa stain. These two are there, which you can use up to stain up these particular smears. Which particular smears? One is buboes and one is blood smear. And what you observe? You observe bipolar safety pin appearance. What you observe? Bipolar safety pin appearance. And what is bipolar safety pin appearance? If you don't know up till now also, what is this? So guys, this is this. That organism is there, which is stained at the poles and in between remains what? Unstained. Gives the appearance of safety pin. So also termed as what? Safety pin appearance or bipolar appearance. Is it fine? And Yersinia pestis is the classical example of the same. It is the classical example of the same. Is it fine? Now, after doing all lab diagnosis stuff, other thing I already told you that you can put the material into the ghee broth, and in the ghee broth, if the organism is there, Yersinia pestis, it will produce which type of a growth? Conical projections. That is termed as stalactite type of a growth. Okay. What is the drug of choice for the plague? The drug of choice for the plague is streptomycin, guys. Okay. The drug of choice for the plague is what, guys? Streptomycin. Streptomycin is the drug of choice for the plague. That also you should know. Other than this, the last major epidemic which came in India, in which a lot of death happened, that was in the Surat, that is Gujarat. Okay, in 90s. In 90s, this particular sort of epidemic came in which number of people they have died off. But now it is very uncommon. I already told you. Is it fine, guys? So if the question comes about the zoonotic infection, you have to write up this much for the Yersinia pestis plague. Is it fine? So if you write up this much also, na, the examiner can't cut the marks. This is the gist of plague. Okay. Now, another important infection which definitely you can get up in the form of MCQ or in the form of short note or zoonotic infection, only it comes in a long question, and then you have to write up this way also. Okay, so in that you have brucellosis, guys. In that, what you have? Brucellosis, and the brucellosis is a zoonotic disease, and obviously done by whom? These particular ones: Brucella abortus, Brucella melitensis, Brucella suis, and Brucella canis. Okay, so what are these particular species, guys? These are the ones which infects of the animals. Okay, so Brucella abortus infects of what? It infects of the cattle. Okay, it infects of what? Cattle. Melitensis, sheep, goat, and camel. Okay, sheep, goat, and camel. That is being affected by whom? Brucella melitensis. Brucella suis infects of what? Pig. You can very well relate also. Suis, sewer, pig. Canis. So that is dog. Okay. Canis is dog. Fine. So Brucella abortus infects of the cattle. Melitensis infects of the sheep, goat, and camel. Suis majorly infects of what? Pig. And Canis, dog. Okay. So these are the animal infections. And how they are transmitted to the humans? Why they are termed as zoonotic infections? The reason is they are termed as zoonotic infection because their mode of transmission is what? Their mode of transmission is by eating and drinking contaminated food and milk products. Okay. Suppose somebody eats up this particular meat, contaminated meat, okay, of these particular animals or their milk products. That is one of the ways by which the brucella infection can transmit to others. Okay. Another way by which it can transmit is aerosol route, guys. Another way by which it can transmit of, that is termed as which route? Aerosol route. So one is aerosol route and one is by eating and drinking contaminated meat and milk products. So that is the mode of transmission of this from the animals to the humans, and that's why you call it as what? That's why you call it as zoonotic infection. That's why you call it as what? Zoonotic infection. Okay. In all these four, the most important which you need to focus upon is Brucella melitensis. Okay. Focus upon one, which is termed as what? Brucella melitensis. And this Brucella melitensis does what? It does acute brucellosis. Okay. Acute brucellosis is also termed as a typhoid-like illness. And this particular typhoid-like illness is having the other names also. Like it is termed as Malta fever. Okay. This is termed as Malta fever. This is termed as Mediterranean fever. This is termed as what? Mediterranean fever. And you can call it as undulant fever also. And why we call it as undulant fever? Because the fever touches the baseline. Okay. So acute brucellosis, which is being done by Brucella melitensis mostly, is also termed as Malta fever. It is also termed as Mediterranean fever. And the third name is termed as what? Undulant fever. And it is which type of illness? It is a typhoid-like illness. What is the meaning of that typhoid-like illness? That is, there is a high-grade fever. Okay, there is a high-grade fever in this particular one. Okay, then there are bone pains. There are bone pains. And in the bone pains also mostly the spine is involved up. And because of that only we tend to confuse it with what? TB. Okay. So bone pains. That is also one of the things. Along with that, hepatosplenomegaly. Okay. Hepatosplenomegaly also is reported up in this acute brucellosis. Okay. So basically night sweats, a high grade fever, bone pains, hepatosplenomegaly, they all are features of what? Acute brucellosis. Fine. Now, these all things you will write up whenever this question comes around, and you will focus upon the lab diagnosis. You will focus upon the lab diagnosis, and in the lab diagnosis, the investigation of choice revolves around the blood culture. Okay, investigation choice revolves around the blood culture. And in this brucellosis only we used to say, na, the classical way of blood culture we used to do, that is Castaneda method. Okay, as it is written also there. Castaneda method. What is Castaneda method? So basically Castaneda method is a biphasic media, guys, which is solid and liquid culture media, which is solid and liquid culture media. In a bottle only, we have both the medias, and that is termed as biphasic media, means liquid also and solid also. What is the use of this? This particular biphasic stuff minimize the contamination. This particular one minimize what? This particular one minimize the contamination. So this one minimize contamination, and that's why we prefer this. And what we do in this Castaneda method or the traditional methods, we take the blood and we take the culture fluid. Okay, we take the blood and we take the culture fluid. In which ratio it is being preferred now? 1:5. Another short note can come regarding blood culture. So that particular ratio you should know, that is 1:5, means if you are taking 10 ml of blood, then you have to take 50 ml of culture fluid. Now the question comes, which culture fluid? Glucose broth. Okay, which particular culture fluid? Glucose broth you can take, BHI broth you can take, others also you can take, but mainly glucose broth here. And in this particular bottle, which you are seeing up this, you can add from your side a particular thing, and that particular thing is termed as erythritol. Okay, so if in the exam, in the form of MCQ also, if they ask a question that which particular substance we add to the bottle to stimulate its brucella growth, if you're suspecting of, because this brucellosis and all, na, these are diagnosis of suspicion. You have to suspect, then only you can find out. Okay, so in that particular, because the person is coming from a rural background, okay, having eaten up unpasteurized cheese, these are the clicks, these are the hints which you will get into the MCQs, that somebody have eaten up unpasteurized cheese and after they reported up this type of fever and have bone pains also in the spinal region. Hepatosplenomegaly is there, high grade fever sometimes. So that sort of thing, if it is there along with the cattle rearing and all these particular history, then you should focus upon the brucellosis. That is one of the zoonotic infections which tends to happen. Is it fine? And in that, you will go for what? You will go for blood culture. And blood culture in which particular ratio? 1:5. Okay. And the culture fluid preferably is what? the glucose broth, and in this bottle, from your side, what you add up? Erythritol. And why we need to add erythritol? Because it stimulates the brucella growth. And why we need to have this castanedator method here? Because guys, this is having solid and liquid culture medias. They are biphasic culture medias. And why they are being used? Because they minimize the contamination. Because they minimize what? They minimize the contamination. Why? Why minimize contamination? Because whenever you do the blood culture, every day you see that. Okay, every day you see the bottle. If it is turbid, then you have to just tilt the bottle so that that particular blood flows over that solid culture media. So what is the use of this? The use of this is that in the subculturing, when you open the bottle, there is a chance of contamination. And here you need not to open. You have to just tilt the bottle. So this is what is the story of castanedator method. So it can be asked in your labs or in the practicals that what's the use of having this castanedator method? The use is it minimizes the contamination. It minimizes the contamination. Is it fine? Then other than that, you have these particular things like catalase positive, oxidase positive, and urease positive. Okay, so catalase, you already know, guys, what is catalase? You take the colonies and in that you add up what? 3% H2O2 and the bubbles they come. So that is the catalase positivity. And we are talking about which organism here in the brucella? We are talking about the Brucella melitensis. Okay, we are talking about the Brucella melitensis, which associates with acute brucellosis, also termed as Malta fever or Mediterranean fever. Then comes the oxidase positivity. Then comes what? Oxidase positivity. And oxidase positivity is what? You have a white color strip, and on that you touch, and the color change happens. And what is it? Color change from white to blue. From white to blue within 10 seconds. Okay, from white to blue. Oxidase test you must be knowing ना. Either a disc or either a strip. Okay, या तो डिस्क होती है या स्ट्रिप होती है, और उसके ऊपर जैसे ही आप कल्चर की कॉलोनी जो है वो लगाते हो, immediately the color changes from white to blue, and that is happening in how much time? Within 10 seconds. And this is termed as which positivity? Oxidase positivity. This is termed as which positivity, guys? Oxidase positivity. And then comes this urease test. Urease test, yellow color media, which changes to pink. And we call it as what mnemonic? Yup. Okay, in the urease media, what is there? Yup. What is yup? The U will make you remind what? It is for the urease, and there is a color change from yellow to pink. So basically, Brucella melitensis is an organism which is catalase positive, oxidase positive, and even urease positive. Even urease positive. Whereas there is a typing also which is being done for this brucellosis, and that is termed as Phage typing. And the name is what? Tbilisi. Okay, Tbilisi Phage typing. This, no, bacteriophages. So according to that, the classification is done. And that particular classification is what? Tbilisi. So that is termed as Tbilisi Phage typing, which is being done for this. Now, the important test which you should mention whenever you are doing a question of brucellosis is SAT. Okay. And this particular SAT is one of the best serological test. Okay. This is one of the best serological test. Okay. Best serological test in what sort? What is the full form of SAT? SAT is standard agglutination test. Okay. Standard agglutination test. And it is being done for brucellosis. Okay. Standard agglutination test. Okay. Now, not going deep into standard agglutination test, I just want to tell her that there is a phenomena in this that is termed as prozone phenomenon. In brucellosis, we encounter a phenomena. And in brucellosis, that phenomena is termed as what? Prozone phenomena. And that prozone phenomena is actually what? Antibody excess. What is that prozone phenomena? Antibody excess. Okay. So this prozone phenomena is to be avoided by dilution. Okay. Remember, in the Viva, they can ask you, what is prozone and postzone? So prozone is what, guys? Antibody excess. Okay, antibody excess state. How to remember? This prozone phenomena you are reading in which particular disease? Brucellosis. Okay, and this particular brucella, remember like this, that there is a guy. Which guy? Bruce Lee. And Bruce Lee is pro-abs. Means what is excess? Antibodies are in excess. Okay. And the post zone is what then, guys? The post zone is antigen excess. What is post zone? Antigen excess. So prozone is antibody excess. How to remember? The Bruce Lee, the famous fighter, is pro-abs. Wants to have what? Abs. And the post zone is what? Post zone is antibody. This is prozone, antibody, and post zone is what? Antigen excess. So what is the logic of all this? The brucellosis is prozone phenomena showing disease. Means there is an antibody excess. And how to remove this phenomena? Simple. You have to dilute the sample. Okay. Dilution of the sample need to be done. And this is what is there in the SAT. Is it fine? Okay. And nowadays for everything what we have PCR, and here also we have PCR for the brucella. And now guys, why I'm telling all this? Because this will be asked. Why this will be asked? Because it is affecting our day-to-day life. In what sort it is affecting the day-to-day life? There are tests for the contaminated milk with brucella. Okay. Why? Because I just told you, how does the infection happens? Contaminated meat and milk. So all the big milk companies which are there, like Amul, Mother Dairy and all, they have to do a test for the brucella on their milk lots every day. Okay, because this is common contamination. So which all tests are there for this particular one that you should know? So one is termed as Rose Bengal card test. Okay, one is Rose Bengal card test. One is milk ring test, milk ring test, and one is whey agglutination test. Whey agglutination test. Fine. So these three names, any of the tests can be done, either of them, Rose Bengal card, milk ring, or whey agglutination test. These are the tests for the contaminated milk for the brucella. Okay. Either of them is being done. So you can put up what? Or. Rose Bengal card test, milk ring test, or whey agglutination test. And what is the drug of choice for the brucellosis, guys? This is also an important question. This can come in the form of MCQ for you also. So drug of choice for this is doxy. Doxycycline. Okay, doxy is the drug of choice for this. And this particular doxy can be mixed up with rifampicin for a better results, or it can be mixed up with streptomycin. Okay, so doxy along with rifa or streptomycin can be used for what? This particular acute brucellosis disease. Okay, so these are the two important diseases which you should mention up whenever you are talking about the zoonotic infection. Okay, whenever you are talking about what? Zoonotic infection. One I have told you the plague, and another one is this. Another one is this particular one. Which one? This particular brucellosis. Okay, this particular brucellosis. So in a short, I have given you a sufficient hint regarding these particular two important things. Okay, other than that, you must have heard of these names also. Whenever you are talking about tularemia, rat bite fever, 1122 lines regarding them, I will tell you. Okay, so tularemia. Tularemia happens to be because of a particular organism termed as Franzella tularensis. Okay, first of all, the name should know. Franzella tularensis is an organism which leads to this tularemia. And what is there in the tularemia? Tularemia is ulceroglandular fever. Ulceroglandular fever, which ought to happens to those which are rabbit hunters. Which are what? Which are rabbit hunters. So Franzella tularensis associates with tularemia, and the tularemia is what? Ulceroglandular fever. means there is an ulcer formation along with the lymphadenopathy, and this particular one is there. That is the I think some updates have happened suddenly. So let us see once. I'm just starting up the broadcast. Don't worry. Not have started. Okay. Okay. So here we are. Is it fine, guys? Now. So this tularemia we talked about, and in the tularemia, you know that it is being done by Francisella tularensis, and it is there in the rabbit hunters, which try to shred the skin of this particular rabbit and lands up with what? Ulcer and gland lymphadenopathy along with fever. This is what is termed as tularemia. Okay, and this particular tularemia organism is also bipolar stained. This particular organism is also what, guys? Bipolar stain, means stain at the poles, in between unstained. Okay, rat bite fever. Rat bite fever is being done by spirillum minus. Okay, spirillum minus. And the another one which does it is streptobacillus, streptobacillus molliformis. Streptobacillus molliformis. These two names you should know. One is Spilum minus and one is Streptobacillus molliformis. They associate at least the names, and this is a potent MCQ for sure. Definitely it can come in the form of MCQ, that the rat bite fever means through the bite of the rat, which particular infections, which particular organisms can be transmitted, which lands to the fever. So one is Spirillum minus and one is Streptobacillus molliformis. Is it fine? The cat and dog bite infections. Okay. In the bacteria, what they can do? In the bacteria, they associate with what? Pasteurella multocida. Okay. Pasteurella multocida associates with this particular organism, Pasteurella multocida. And how to remember? The Louis Pasteur, who is father of microbiology, is being bitten by whom? Cat and dog. Okay, remember like this. Always tries to make what? Upset associations. You'll remember it for a long time. Okay, you'll remember for a long time. So human infections. Even the human bites can does the infection. So this I have just kept up to tell you extra thing. Obviously, it doesn't associate with zoonotic infection, but all of other things you can write up in the zoonotic infections whenever this question comes. Okay, in the human bite infection, suppose you have got in a fight with your friend or your any other fellow, and you have bitten that particular one. So there also the infection can happen up. And which organ is responsible, guys? So there is one which is termed as Echinella cordens. Echinella cordens. This is the organism which associates with this human bite infections. And along with that, you have anaerobic streptococci. Anaerobic streptococci. Okay. So Echinella cordens and anaerobic streptococci, these are the ones which associate with what? Human bite infections. They associate with what? Human bite infections. Is it fine? Now, other than that, another important question which can definitely be there in the exam is regarding the STD, sexually transmitted diseases, or some genital ulcer diseases. For that, in a quick recap, I give you the various important aspects and how to remember them in a short file. Okay, so as you can see, this particular question, first of all, guys, a 29-year-old men is there, had an unprotected sexual intercourse, developed a lesion of penis, which is painless and hard. Okay, painless and hard. On examination, the inguinal lymph nodes are found to be enlarged and hard along with the non-tender stuff. So that is not having the pain. Means they are hard, enlarged, and they are non-tender. And the serum sample collected of the patient, obviously the blood sample collected to the patient, sent to the microbiology lab for the examination. So first of all, what is this disease that we are talking about? Okay, so guys, this disease is syphilis. This particular disease is syphilis, and syphilis is famously for this particular stuff only, that it is having a painless and a hard chancre, ulcer. Okay, so that particular painless and hard lesion, that ulcer is there in the primary syphilis. It is there in which particular one? Primary syphilis. Okay, this particular thing is in the primary syphilis. Fine. And along with that, the inguinal lymph nodes are also enlarged and non-tender. Okay, means this is painless. And this painless stuff strongly associates with what? This strongly associates with syphilis. Okay, so let's discuss up the various names which can come in your exam, which you need to focus upon. Okay, what is there? The incubation period of all of them can be asked in your exam. So syphilis is having an incubation period of how much? 9 to 90 days. Okay, actually 10 to 90, but for rhyming up, 9 to 90 days for the syphilis. Herpes infections are a weak one, 2 to 7 days. Okay, 2 to 7 days. Chancroid. This particular chancroid is being done by which particular organism, guys? Hemophilus. Hemophilus ducrei. Hemophilus ducrei. And see the incubation period. It can be 1 to 14 days. Very variable. 1 to 14 days. Lymphogranuloma venereum. And lymphogranuloma venereum is done by chlamydia. Okay. Chlamydia trachomatis. Okay. Chlamydia trachomatis. And which particular strains of chlamydia trachomatis? L1, L2, L3. And more by which one? L2. Okay. Then comes this donovenosis. And this donovenosis is mostly being done by whom, guys? Donovenosis is done by Klebsiella. Klebsiella granulomatis. Okay. Klebsiella granulomatis, which is also termed as Calymitobacter granulomatis, which is also termed as what? Calymitobacter granulomatis. Okay. So these organism name you should know, and whenever a short note or any MCQ comes over it or a long question, you have to tell about all of them. Okay, and let's tell about the important entities which you have to write up when this question comes. So guys, first of all, they will ask you regarding the genital ulcer. And the genital ulcer in the case of syphilis, just now we have seen in the question also, it is painless. Okay, indurated means hard, and it is single. Syphilis is single. Okay. So this particular single painless indurated genital ulcer is a characteristic feature of what? S. You can remember like this, S, single. In the syphilis, a single painless indurated ulcer is observed. And it is observed in which particular stage, guys? It is observed in primary syphilis. It is observed in what? It is observed in primary syphilis. Okay. Along with that, if somebody talks about the lymphadenopathy, that is also painless. I told you, na, that is also painless. And there is swelling, but it is not being told as sort of a buboes. Okay, so painless inguinal lymphadenopathy is also observed in whom? It is also observed in syphilis. Okay, so lymphadenopathy is also painless, ulcer is also painless. So painless state is syphilis, and the ulcer is single, that is S. Then comes the herpes, and herpes, you know, it is a viral infection. Okay, herpes is viral infection, and herpes infections are very, very painful. Okay, they involve the nerves. Painful. Multiple they are, and they are painful. So herpes lesions are multiple and they are painful. And inguinal lymphadenopathy or any sort of lymphadenopathy is absent. Okay, so absent lymphadenopathy is a feature of herpes. Now, talking about the chancroid, which is having the incubation period of how much? 1 to 14 days. I told you the chancroid is being done by what? Hemophilus ducrei. Okay, chancroid is being done by what? Haemophilus ducrei, and this particular one is painful, and this is not hard. This is soft, and because of that, it is also termed as soft sore. It is also termed as what, guys? Soft sore. So it's painful and soft, also termed as soft sore, and it can be single like syphilis one, or it can be multiple. So now in the syphilis it was single, and in the herpes it was multiple. So it can be single or multiple in the case of whom? Chancroid. And it is painful and it is soft. And how to remember that it is painful and soft? Painful is this way, dukrai. The fellow cries in pain. Or in Hindi you can say dukhrai. Okay, so now you will not forget that this particular one is painful. So it is painful and soft, also termed as soft sore in the chancroid. And as far as the lymphadenopathy is concerned, that is also painful. Okay, that is also painful and it can also be soft. Painful and soft lymphadenopathy can be observed in chancroid. Can be observed in chancroid. So this also means the chancroid is done by Dukrai, Dukhrai. Everything is painful. Everything is painful. In English, you can say Dukrai. Now talking about the LGV, lymphogranuloma venerum. See the incubation period, guys. So much variable. 3 days to 6 weeks. And to simple ones, you can remember up 3 to 30 days. Like that, you can remember off. And here also the ulcer is painless, like in syphilis. But the lymphadenopathy is opposite. It is painful and it is soft. So this marks the difference between syphilis and this. It is painful and soft lymphadenopathy here. But the ulcer is painless. But the ulcer is what? The ulcer is painless. Is it fine? And as far as the donor venosus is concerned, which is done by Klebsiella granulomatis, guys, the incubation period is 1 to 4 weeks. And this ulcer is painless. What is this? This is painless and it is a beefy red ulcer. It is painless, beefy red ulcer. This donor venosus is having what? A beefy, painless red ulcer. If you touch this, it bleeds on touch. Okay, it bleeds on touch and there is no true lymphadenopathy. There is granuloma formation. And that granuloma formation is termed as what? Pseudobubose. And this pseudobubose is due to what? Certain subcutaneous swellings. So basically, these are granulomas. These pseudobubose are what? These are granulomas. And that's why what we say that in the donor venosus, what we have this pseudobubose. That is they are not the lymph nodes, they are the pseudobubose. They are not the real swellings. Is it fine, guys? So what we have in this? Syphilis, herpes, chancroid, LGV, donor venosus. These names you should know. And if you go in a sequence, remember like this, SHE, she, somebody's she, okay? And which disease it is having? CLD, okay? CLD, chronic liver disease. So you will get the things in a sequence. How? Syphilis, herpes, chancroid, LGV, donor venosus, okay? Which is painless? Painless is syphilis, which is being maximum mass. Painless and hard. Which other guys are painless? In the LGV and donor venosus also, there is a painless stuff. Okay, which is really painful? Herpes and chancroid. Both of them, they are painful. Okay, so like this, you have to make up some of your mnemonics also to remember them for a long time. To remember them for a long time, you also have to make your mnemonics. Is it fine? And in the last, I like to tell you something about the syphilis because syphilis is one of the topics which can definitely asked as a long question also. Okay, so syphilis can be asked in a long question method also. Now, in the syphilis, first of all, you should know that which is the causative organism which does the syphilis. So, causative organism for the syphilis is Treponema pallidum, guys. Okay, what is that? Treponema pallidum. And the Treponema pallidum is a spirochete. Okay, what is Treponema pallidum? Treponema pallidum is a spirochete. And why we call it as a spirochete, guys? Because it is spiral in nature. So that's why it is termed as what? Spirochete. And this particular Treponema pallidum does what? Syphilis. What it does? It does syphilis, and syphilis is a STD, sexually transmitted disease. Syphilis is what? It's a sexually transmitted disease. Just now we have done, it is having incubation period of how much? 9 to 90 days. 9 to 90 days. And as far as the stages are concerned, there is a primary syphilis stage in which there is a hard, painless chancre. Chancre means ulcer, I told you. And along with that, there is a hard, painless inguinal lymphadenopathy also in the primary syphilis. ओके तो ये होता है प्राइमरी सिफिलिस में. फिर क्या होता है, फिर ये भी ठीक हो जाता है विद टाइम. दिस ऑल्सो गोज ऑफ. ठीक है, तो पेशेंट सोचता है मैं ठीक हो गया, लेकिन उसकी खुशी जो है वो थोड़े दिन ही रहती है और उसको क्या आ जाते हैं सेकेंडरी सिफिलिस के फीचर्स. और सेकेंडरी सिफिलिस के फीचर्स क्या है गाइस? व्हाट आर द सेकेंडरी सिफिलिस फीचर्स? रैशेस. रैशेस ओवर द पाम्स एंड सोल्स. ओके, पाम्स एंड सोल्स के ऊपर रैशेस आ गए तो पेशेंट सोचता है कि इस स्टेज में मुझे डॉक्टर के पास जाने में संकोच नहीं होगा. Okay, so that fellow can go to the doctor and shows the rashes of palms and soles, and the doctor takes the history that there is some sexual transmitted have you involved up in any unprotected sexual intercourse? The patient says yes, and then yes, it's the stage. Which stage? Secondary syphilis. And here what you observe is this condyloma lata, also termed as condylomata lata. And these are the lesions which are found in the anal region or on the skin also. You can find these particular condyloma lata, and they are said to be the most infectious lesion of syphilis. They are said to be what? The most infectious lesion of syphilis. And with time, this all things also goes off. With time, this all things also goes off. Patient thinks now I'm okay. But which stage is starting up? Latent one. So latent syphilis stage, the patient have gone up. And what exactly happens in the latent syphilis stage? In the latent syphilis stage, this can vary for 5 to 10 years. Okay, the patient can be in this stage for how many years? 5 to 10 years. And what happens? 60% of the individuals, because of their immune response, immunity, they themselves get treated. Okay. But unfortunate 40%, they progress to what? Tertiary syphilis. And the first thing which they manifest is gammas or gummas. Fine. These skin lesions are observed in the tertiary syphilis, gummas. Okay. 60% लोग ठीक हो गए, 40% प्रोग्रेस करे किसमें? टर्शरी सिफिलिस में. तो इन बिचारों के लिए बहुत बड़ा गम है ना कि यार हमें क्यों हो गया ये टर्शरी सिफिलिस. तो गुमाज अ सीन इन व्हाट? क्या गम है कि हमें टर्शरी सिफिलिस हो गया. सो रिमेंबर लाइक दैट, द गुमाज अ सीन इन टर्शरी सिफिलिस. And after that, it can complicate further, like with the neurosyphilis features, means the CNS and all is involved, or in the cardiovascular stuff involvement. In the neurosyphilis, what you observe, guys? In the neurosyphilis, we have GPI, general paresis of insane, and tapes dorsalis. Okay, there is one general paresis of insane and one is tapes dorsalis. What is general paresis of insane? In this, the patient starts talking irrelevant and reports up regarding what? Some weaknesses there in the limbs and all. So that is termed as general paresis of insane. Other one is what? Tapes dorsalis. Tapes dorsalis is posterior column is involved. Posterior column is involved. As far as the cardiovascular syphilis is concerned, this associates with what? Ascending aortic aneurysm. Okay. And what is aneurysm, guys? Aneurysm is dilatation. And which particular aorta is being dilated? Ascending aorta. The ascending aortic aneurysm, that is cardiovascular syphilis. This one presents up with this ascending aortic aneurysm. Is it fine? So one is GPI, that is in the neurosyphilis, and tapes dorsalis, the posterior column is involved, and one is cardiovascular syphilis, which presents with what? Ascending aortic aneurysm. Fine. So these are the complications of the tertiary syphilis. Now, another question which comes up is regarding the lab diagnosis of syphilis. Definitely this question comes up and you should know about it. Now, non-treponemal test. Non-treponemal test means they are not very sensitive and specific. Okay. And what comes in that? VDRL and RPR. VDRL stands for Venereal Disease Research Lab and RPR stands for Rapid Plasma Reagent. Okay, Rapid Plasma Reagent. Now the question comes, which one is better? VDRL or RPR? So guys, better is RPR. Why? Because this is a card test and this is economical. VDRL problem is we need a microscope for this. we need fluid to be prepared, and this particular fluid is to be used in how much time? 24 hours. Suppose on that particular day you have not got any sort of a sample, so that will be a problem for you, na? So that's why we say that VDRL is not so good test as RPR, but VDRL takes an edge whenever somebody is going for diagnosis of neurosyphilis. Okay, so if the CSF is the sample, RPR fails. Okay, RPR fails, and that's why you have to go for what? VDRL CSF. You have to go for what, guys? You have to go for VDRL CSF. Okay, you have to go for the VDRL CSF. Is it fine? Is it okay? So VDRL CSF is said to be the investigation of choice for neurosyphilis, guys. Another question which can come. Investigation of choice for neurosyphilis is what? That is the VDRL CSF. VDRL CSF. Now, talking about the treponemal test, which are more sensitive and specific. And that particular one is what? More sensitive and specific treponemal test. What is the name of them? FTA-ABS. Fluorescent treponemal antibody assay. Okay, means fluorescent microscopy is used in this. Then TPI, Treponema pallidum immobilization assay, means with the help of live treponemes, you try to immobilize these particular, in this what we use? That antigen antibody stuff. Okay, so we try to immobilize these live spirochetes with the help of its anti stuff. So that is termed as Treponema pallidum immobilization assay. But there is a problem with this particular test, that we use live treponemes. So live treponemes is a problem for that particular individual also who is doing the test. So that's why it is not done. TPHA is one of the common tests which is being done. Treponema pallidum hemagglutination assay. Okay. And at least the name you should know. If you don't know much about this, what is happening in them, but you should know the names. FTA-ABS is said to be the most sensitive test for syphilis. And the most specific as per the books is TPI. Okay, in which live treponemes are used and they are being immobilized with the anti-sera of it. Okay, and that is termed as TPI. TPI is not performed routinely. What is being performed routinely? TPHA. So most common done test here in this syphilis is, that is the TPHA. Treponema pallidum hemagglutination assay. It is more sensitive also. It is more specific also. Okay, there's a sensitive and specific both, which you need to know. And theory wise, what you have to write up in your exam, most sensitive is FTABS and most specific is TPI. Is it fine? Now there is an entity termed as congenital syphilis also, and this particular congenital syphilis is having all those Hutchinson's triad and all those particular ones, na? Hutchinson's teeth and all this particular one. So that is itself is a topic. What I want to tell up in the congenital syphilis here is that you go for IgM FTA ABS. Okay, this particular testing is being done for the congenital syphilis. IgM FTA ABS. Okay, IgM FTA ABS. Why IgM FTA ABS? Because if the newborn is having congenital syphilis, so obviously which immunoglobulin that fellow will produce? IgM. So IgM FTA ABS you have to go for to find out the correct diagnosis of congenital syphilis. Okay, congenital syphilis. So this is what is the story of the Treponema pallidum. And what is the drug of choice for this guy? The drug of choice for this particular syphilis is still what? Penicillin. Penicillin is the drug, benzathine penicillin or procaine penicillin or aqueous crystalline penicillin. These are being used in the various stages of the syphilis. Is it fine, guys? So syphilis is definitely a long question also which can come. These are the various tests which you should know. That is the non-treponemal and treponemal. In the non-treponemal, we have VDR and RPR. Which one is better? RPR, because this is cost effective. But in one sample it fails, that is CSF. In that you have to go for VDRL. That is the CSF one. VDRL CSF is the investigation of choice for neurosyphilis. That is there. The treponemal test, three names: FTABS, TPI, TPHA. FTABS is fluorescent. Fluorescent microscopy is being used in this. and it is for the antibody assay. TPI, trypanosome pallidum immobilization assay, means with the help of antibody, you want to detect up the antigen. Okay, TPI, TPHA is the most common done. TPI is immobilization assay, and FTABS is said to be the most sensitive. Most specific is TPI. When you will see the book now, you will confuse like anything, what to write and what not to write. If you write this much also, I guarantee you, nobody can cut your marks. Okay, nobody can cut your marks if you write up this much also regarding the syphilis. So guys, what we have read here, we have read up that these particular names you should know. She have CLD, chronic liver disease. Okay, so this gives you a sequence. By this sequence, you can remember of that which are the names of the various diseases: syphilis, herpes, chancroid, LGV, donovenosis. Okay, and regarding the 1 on 2 lines, if at all this question comes up in a long way, you can write up that way also, and they can ask you to describe the syphilis in this particular one. Okay. So as such, guys, this much for today. Zoonotic infections along with this genital infections and all. So in your exam, they can ask you regarding the hand washing stuff and all. So guys, for that also, I'm telling you here itself that remember, if you are not remembering anything, okay, in the exam, you get confused up, then also you can go for this mnemonic and at least write up something in your exam. Suman K. Suman Kumari. Okay, you can write up anyway. So S is what? That you have to put your hands like this, Seedha. Okay. Then U stands for what? Ulta. Then M stands for this muthi. Okay, this muthi. A is what? Angutha. N is what? Nakhun. That is nails. Fine. And K is what? Last one, the kalai. Okay. So this is basically for the healthcare workers to simplify the things we try to tell them. Otherwise, you follow up the same sequence which is there in your book. But if you get confused in that, at least try this. Okay, Suman is what? First of all, Seedha, then Ulta, then this. Okay, then Angutha, then Nakhun. So this you know, like this. And then the Kalai. Okay, so the Nakhun one is this, like this. Tararara step. Okay, Nakhun one, nails is this one. So at least it gives a sequence. Nobody can cut this in your exam for sure. If you write up this much also, na, Seedha, Ulta, Mutti, obviously you will not write the Mutti and all. You will like this. Just for the remembrance sake. A is Angutha. Angutha means this thumb. And N is nails. Nails is this. And K is Kalai. This one. So this definitely can come in your exam. Another question which can come up is regarding the, what do you say? That spill. If some spill happens up in your hospital and all, what you will do? So guys, whenever a blood spill and happens now, so at least you should able to tell that you are using up sodium hypochlorite. What are you using up? Sodium hypochlorite. How much? 0.5 to 1%. 0.5 to 1%. And as an intern, if that blood spill happened from you only, what you will do? You will contain the spill yourself. You'll put the tissue towels, you will put those towels, they come, paper towels and all, or tissue papers you will put over it. Means in any of the blood spill, what is the first thing to be done by you if you are there at that particular one, or you only have done the spill? Contain the spill. And what is the logic of this containing the spill? Because you should not trickle down the doors and all. So you should contain the spill. So contain the spill, then ask the infection control team of your hospital to come. They will put this 0.5 to 1% sodium hypochlorite over it. They will wait for certain time, okay, 15 minutes and on, okay, and then they will clean up as per the standard protocols. Fine. So this is the way. Means what I want to say, that what you use sodium hypochlorite, and the major step first is what? You should contain the spill first, and then you can go for the other steps. Is it fine, guys? So this is the regarding the blood spill. Other than that, they can ask you something about the needle stick injury also. NSI, needle stick injury. So needle stick injury whenever happens, okay, I'm just telling you what you can write off. If the needle stick injury happens up, what you should do, guys? Never do the squeezing. Okay, you should not squeeze like this. You just have to put your finger under what? Running tap water until the bleeding stops itself. Then try to find out whether that person who from which while performing the duty of yours to withdraw the blood and all, that particular individual is what? Is it HIV positive, hepatitis B positive, hepatitis C positive? So you need to find out that particular individual patient on whom you are performing of the things, what is the status of that? That is important. Okay. And by chance, unfortunately, you got to know that that particular individual is HIV positive, then there is a separate protocol which you have to follow up, which is termed as PEP, post-exposure prophylaxis. And this post-exposure prophylaxis should be started up within how much hours? 2 hours, the best. And after 72 hours, no use. Means up to 72 hours, if you use up, then only there is a betterment. Otherwise, there is of no use after the 72 hours. And best is within 2 hours, and you try to use a what? The famous combination. The famous combination is tenofovir, lamivudine, and dolutegravir. These three, they come and they have to be taken for how much time? They have to be taken for 28 days without fail if you want to avoid of the risk of HIV in the needle stick injury from a HIV positive patient. Okay. So TLD is what, guys? TLD is tenofovir, lamivudine, and dolutegravir. Okay. So these three names you should know: tenofovir, lamivudine, and dolutegravir. And this is to be given for how many days? 28 days. So this you should know in a HIV positive one. And if the person is hepatitis B positive, okay, if the person is hepatitis B positive, suppose the person is there, from there the needle stick injury happened, then what to do? So guys, in this you have to look out for the titers of the individual to whom the injury happened. And if suppose you are a healthcare worker, you already have taken up the hepatitis B vaccine, so, okay, and you have got a needle stick injury from a hepatitis B positive individual, and suppose you go for your titers, and those particular titers, they are found to be anti-HBs titers, are found to be more than 10 milli international units per ml. Okay, this much if it is level of yours, titers, after the vaccination, everybody takes it. All the medical students must have taken it. Okay, so you should check your titers first by ELISA. Anti-HBs titers, if it is more than this, then no need to worry. Okay, then no need to worry. But if they are less than this, then definitely you have to worry. And you have to take up what? The immunoglobulins immediately, preferably within 7 days. Okay, and you can take immediately also, preferably within 7 days. After that, no effect. So within 7 days, you should take up the hepatitis B immunoglobulins. These are available. Okay, and if these titers are less, so you can start up with the hepatitis B vaccine also. You can start up with the hepatitis B vaccine booster dose. Okay, booster dose. So this hepatitis B booster dose also you can take up. So hepatitis B and HIV, you have this post-exposure prophylaxis. For hepatitis C, you don't have any post-exposure prophylaxis. But if the hepatitis C positive needle stick injury happens to you, then the important thing is to diagnose the infection and start the drugs as soon as possible. And if you're able to start up the drugs as soon as possible, what will happen? That will help you to combat the infection in the initial stage only. So that is also important, that if it is hepatitis C, you don't have any post-exposure prophylaxis, then you have to wait up when it happens. But when it happens, when it starts coming up in the test, start the antiviral drugs for that. And they are so good nowadays, antiviral drugs, they will combat the infection wonderfully well. Okay, guys? So these all things like needle stick injury, blood spills, okay, these hand washing steps, definitely will find them somewhere in the exam. Is it fine, guys? So thank you so much. If you have any of the queries, you can ask me on my Instagram by my name, Sonu Panwar. It's there. You can ask up in the groups or in this comment section of this particular video. Also, you can ask up any of the queries which you are having up. Okay. And you can join me up on my channels and all. And you can ask up your questions. And in the DocTutorials WhatsApp group also for the MBBS, there also you can tag me up and can ask. Okay. So thank you so much. Best of luck from my side. Happy reading. Okay. So take care, guys. Bye bye.